Good morning. I'm delighted to welcome you to BARDA Industry Day. Bringing innovators from the private sector, academic institutions, and across the government together is an essential part of our mission to save lives and protect Americans from health impacts of security threats. And those threats are constantly evolving. To accomplish this mission, we're focused on strengthening our nation's public health and medical infrastructure and on the capabilities necessary to quickly mobilize a coordinated national response to disasters and emergencies that spans all public health emergencies, whether they are man-made or naturally occurring. Working together has never been more important than it is today. ASPR has played a critical role in leading the current national response to COVID-19. Let me touch on just a few ways in which ASPR remains at the heart of the response. Our incident managers and National Disaster Medical System responders were the first to deploy to support COVID-19 repatriation operations. Since the spring of 2020, thousands of federal response personnel have deployed multiple times to areas experiencing the greatest need, from New York to Alaska, from California to Guam, and everywhere in between. The Strategic National Stockpile is also part of ASPR and serves as a short-term stopgap for our nation's frontline healthcare workers. From the beginning of our COVID response, the SNS has provided PPE, medical equipment, and supplies and replenished the national stockpile at record speed. Our SNS team has left no stone unturned in their efforts to acquire the appropriate equipment and supplies to combat COVID-19. ASPR's National Healthcare Preparedness Programs awarded $350 million in funding to aid U.S. healthcare systems with getting healthcare workers the training and resources they need to respond to the threat from COVID-19. ASPR's therapeutics team led the allocation and distribution of the first 3 therapeutics approved for emergency use by the FDA for the treatment of COVID-19. Shipping a total of more than 3 million doses of therapeutics to almost 9,000 treatment sites across the country. As part of the ASPR organization, BARDA too plays an immensely critical role in the COVID-19 response. Working with many of you, BARDA has supported development, large-scale manufacturing, and procurement of vaccines, therapeutics, and diagnostics. Thanks to you and our experts at BARDA, we now have 91 products in development or available to combat COVID-19. That includes more than 144 million diagnostic tests, 4.5 million therapeutics, and over 400 million doses of COVID-19 vaccines. Every one of these successes represents the work of multiple partners across the government and private sector, working together to respond to the pandemic and to save lives. Even though we are still very much focused on helping our nation emerge from the COVID-19 pandemic, we are continuing critical medical countermeasure development efforts across our entire portfolio because we know that the next emergency can occur at any time. We must strengthen our nation's preparedness so that we are ready and able to respond, whether we face a natural disaster, a chemical, biological, radiological, or nuclear incident, or another pandemic caused by influenza or by any other emerging infectious disease. The American people deserve a robust response from a healthcare system that is at the ready, a system that includes having the equipment, supplies, active pharmaceutical ingredients, and medical countermeasures available when and where they are needed at a moment's notice. To increase U.S. readiness for public health emergencies, we must expand and strengthen our collaborations with existing industry partners and grow the community of partners with whom we collaborate. Building a stronger, more agile system of preparedness means supporting private sector partners to acquire needed raw materials, retool manufacturing machinery, and train the workforce. BARDA and other offices in ASPR are focused on this. Building a robust domestic industrial base and developing new medical countermeasures requires that we widen our engagement. We need the views of the innovators, the entrepreneurs, health officials, first responders, and the people we are trying to protect. Developing effective medical countermeasures requires an upfront understanding of how products work in the real world and what we can do to make the products easier and faster to manufacture, distribute, and use. We've been able to distribute hundreds of millions of COVID-19 vaccine doses throughout the United States, but every one of us knows how much easier that would be if vaccines could be transported without freezers or refrigerators, or administered without needles. We all know that some products may work well in one setting and not as well in another. Getting more people from more diverse communities involved in developing or as champions for innovative medical countermeasures may help us overcome challenges. A more inclusive public health community strengthens our readiness and our response to whatever future threat emerges. It also is one of the best ways for people to gain confidence and trust in the safety and effectiveness of medical countermeasures, so they know that using these products in emergencies truly is in the best interest of society. We know that innovation happens everywhere. Part of what makes BARDA Industry Day so important and exciting is that it's an opportunity for us to broaden our community, to exchange new ideas, to learn about what you are working on, and let you know how you can work with us. Thank you so much for helping make sure our country has the tools we need to fight against current and future threats. As we prepare for whatever comes next, your work, your dedication, and your innovation gives me confidence that we can respond to future challenges and meet our country's needs. Thank you so much for participating today.